Hi, everybody. Patty Gieselman from Choices Counseling and Skills Center in Sierra Madre, California. I want to let you know about a training that the Institute for Girls Development and our program is going to be offering in April. April 11th through 14th, we're having a training with Dr. Shari Manning and Annie McCall, who are going to be talking about the art of moving from conceptualization to exposure for emotional avoidance. It's an advanced DBT training for those who have DBT experience. And Dr. Manning has been kind enough to spend a few minutes and offer up an interview to tell us a little bit about it. If you'd like to watch, join us. Hi, Patty Gieselman here from Choices Counseling and Skills Center in Sierra Madre, California. I want to welcome Shari Manning. Dr. Manning, welcome. We're so glad you're here today to come talk about the training you're going to be doing. We are so looking forward to you coming to sunny California in April to present the art of moving from conceptualization to exposure for emotional avoidance. This is an advanced DBT training we've invited you to come do, and we're so excited you're going to be with us for those 4 days.
I'm looking forward to being there and being with you all. I just kind of want to talk for a moment about the training and what we were thinking when we developed this training.
That'd be great.
So there's now research in DBT about using prolonged exposure for the treatment in stage 2 of PTSD. And theoretically, the belief is that stage 2 will be a treatment for some kind of emotional or experiential avoidance. It may be PTSD, it may be OCD, it may be panic control, it may be outsiderness or that chronic emptiness that our people have. And the question is, how do you get there and what do you do? And so, how do you get there? We answer the first day, which is really having a conceptualization of your client and of the treatment that look at where, when, and how are you going to do exposure in your treatment. We have informal exposure, which is in stage 1. We have the more formals that are in stage 2. And how do you know when you're moving from one to the other? Then the last 3 days of the training are really about how to do exposure, whether you're doing an exposure protocol or you're doing a little exposure treatment of a behavior that shows up in the therapy room in individual therapy, or whether it's exposure when you get a client to do homework review and skills training group and shame comes up. How do you do the principles of exposure? And we will walk you through the more formal aspects of setting up a hierarchy for in vivo exposure and doing imaginal exposure and how to get people to make contact with the cues. And then we'll talk about how to use informal exposure, what to do to treat ourselves. It's really important. Sometimes what happens with exposure is that the therapist is actually the one who avoids. That, we all will talk about doing exposure and we'll say to the client, we need to expose you to this. We're going to expose you to this. We never actually do the exposure itself. And so how do we treat ourselves and how do we work with our team to ensure that we are doing exposure when we need to be doing it? This training has a lot of experiential components in it. We ask people to come up with their own exposures and do their own exposure homework. We get people to run informal exposures and formal exposures in front of the room. I've had so much stuff treated because people have treated me with exposure while doing these trainings. So you will have a lot of opportunities to see exposure done live and to practice it yourself.
Shari, as you know, I took this training with you back in South Carolina a couple of years ago. And I had some huge exposure experiences in that. But it was so great to be able to practice in a safe environment. And I learned so much from you. I really wanted my team to be able to have this experience. And I'm just so grateful for you bringing it to Pasadena, California. This is just an opportunity for my team and the other DBT teams that are going to be coming. Everybody that's coming is going to have some good, solid, fundamental DBT training under their belt. So they'll be ready to look at that shift from stage 1 to stage 2. And I know we go back and forth sometimes at the end of stage 1 into stage 2, and then kind of the back to stage 1 and back to stage 2. And your coaching and teaching was so helpful.
That's great. Yeah. I mean, I think that, this when do you do it is kind of an emerging issue.
Yeah.
And then how do you make that transition? These things that we set up called behavioral tests, which are little mini exposure practices that you do in stage one to really help people to um, practice making contact with the cues and allow you as the therapist to see, can your client experience emotion, can they end emotional experiencing, do they have the capabilities to do exposure. So we spend time on that, and that actually is a part of the stage one treatment. So we'll spend a lot of time going back and forth between the stages, because if you know how to do exposure, you can pull anybody's protocol in.
You said something at one of the meetings. I've actually enjoyed your trainings, different types of trainings. But one thing you said that really kind of stuck with me was the reason we go through stage one in DBT is to get to stage two. Can you tell me just a little bit more about that?
Sure. I mean, I think some of this has happened historically with DBT because DBT has been so effective at treating life threatening
Yeah.
behaviors. That DBT has been known to be the treatment of suicide, the treatment for self harm behaviors. And in actuality, we treat those behaviors to get them off the table so that we can treat other things that are about getting clients to quality of life. And we've now realized that so much of the problem behaviors of our clients are directly about emotional avoidance that we are pulling the prominence of exposure into the treatment. So from day one of pre-treatment of stage one DBT, we are talking about exposure. We are talking about stage two. And we're learning skills and learning how to experience emotion in the service of treating what is often considered to be the developmental causes of a lot of these behaviors are now showing up in our clients.
And that's whether it's those PTSD, big T, big trauma experiences, or the ongoing traumatic invalidation of being in an invalidating environment.
Exactly. One of the things I really love that's in development now and used a lot is treatment of the little t
Yeah.
trauma, pervasive invalidation, where you have a person who has like memories of, mom calling them fat in the dressing room while they were trying on clothes
Yeah.
that have now impacting them currently in their ability to experience life fully. And how do you treat those? And that those are their own exposure treatment. And so when our clients come in and say, well, I don't have trauma, meaning PTSD, that for a good many of our people, what they do have is traumatic invalidation, and that we can treat that as the stage two treatment also.
Shari, thank you so much for giving a few minutes of your time. We're looking forward to seeing you in Pasadena, California. And it's going to be from the Wednesday, April 11th through Saturday, April 14th. And we're so looking forward to working with you and spending time with you and socializing with you and you getting to know us. So we welcome anybody to be interested in coming along. And this is going to be a great, great 4 days. Thank you, Shari.
Thank you.
Bye-bye.